Hello, this is Mary George, OET trainer at Medcity International Academy, Thiruvella. All of us have assumptions regarding OET, and most of the time it turns out to be myths. Today we shall handle a few of them. Number 1. The OET exam is easier than other language exams. This is not true. OET is equally challenging when compared to IELTS, TOEFL, PTE and other language assessment tests. It is specially designed for medical professionals. It uses real-life healthcare scenarios. Its level of difficulty depends on how well you have prepared for the exam. Number 2. OET exam evaluates your medical experience. It does use real-life situations, but it does not test the candidate's expertise. This means that if you fail to present yourself well as a healthcare professional, your OET score will not suffer as long as you have been able to communicate well. Number 3. You have to study up in all medical fields to pass. The OET exam is customized to the taker's field of specialization. If you take the OET for nurses, you will not face the tasks doctors are privy to. A high OET grade is a sign that you are both an excellent communicator and a skilled medical professional. Number 4. You don't need to prepare if you are an excellent nurse. This is a popular misconception. OET is a language test. It is not a board exam. It does not matter if you are a topper in your class or you are the best nurse in the department. You cannot achieve the top grade if your English communication skills leave a lot to be desired. Number 5. You need to use fancy grammar and vocabulary in the writing subtest. This is a very common misconception among OET takers. You do not have to show off all the fancy words that you know to get a high score. Instead, it can turn out to be a disaster if it interferes with communication. Instead, you need to make appropriate grammar and vocabulary choices to convey the information in the case notes effectively, accurately, and efficiently. Number 6. You will be penalized for exceeding the word count in the writing subtest. This is a big myth that needs to be wiped out. The word count of 180 to 200 given for the letter in the writing subtest is a guide. It is a range within which you have to select and express the relevant information in a concise manner. The OET assessors count the information and not the words. If you are regularly using more than 200 words when practicing, you need to improve your skill on concising the language. Make sure these myths do not suppress your full potential and affect your performance in OET. I hope this presentation has cleared a few wrong ideas that many have about OET. Wishing all the aspirants of OET a grand success. We open our regular classes on 4th October 2021. Classes will be functioning as per the COVID protocol. For more information, please check the given contact details. Thank you.
Medcity International Academy. Trusted hands forever.